Does Ontario need more private healthcare? Ontario's healthcare system is in crisis. The Doug Ford government has a controversial plan it says will alleviate some of the pressure. But first, you should know this. Ontario's healthcare system includes a mix of public and private hospitals and clinics. In all these places, Ontarians can access a lot of free healthcare services if they have an OHIP card. But other services might require private insurance. Okay, back to the plan. In May, the provincial government passed Bill 60, known as the Your Health Act. The bill will allow private, not-for-profit, and for-profit clinics to conduct nearly 60,000 more OHIP-covered surgeries and scans. That includes cataract surgeries, minimally invasive gynecological surgeries, as well as MRI and CT scans. Eventually, the goal is to fold in knee and hip replacements. The provincial government argues that this is a necessary step to help reduce the province's giant surgical backlog and long wait times. But experts and advocates are split on the subject. On one hand, supporters say Bill 60 will improve patient care. In early 2022, 105,000 patients in Ontario were waiting longer than recommended for surgery. That's a 123% increase compared to pre-pandemic levels. Supporters of the bill argue that outsourcing some surgeries and diagnostics will only make the system more efficient. And as long as these services are publicly covered by OHIP, Ontarians shouldn't let their fear of US-style privatization cloud their judgment. Supporters also argue that the bill is just a modest expansion of how a lot of healthcare delivery in Ontario already works. We have more than 900 independent health facilities, which are privately owned clinics that deliver OHIP-insured services. On the other hand, critics see Bill 60 as a fatal risk to Canada's universal healthcare. Private, for-profit clinics could lure surgeons, doctors, and nurses out of the public system because for-profit clinics can sometimes pay them more. That could mean even longer wait times at hospitals. The Ford government says it'll require private clinics to submit staffing plans to avoid this. But some doctors aren't convinced. They would rather see more funding directed to the public healthcare system. Plus, data out of BC and Quebec suggests that surgeries at private for-profit clinics actually cost governments and taxpayers more. Critics say that private for-profit clinics could also upsell patients by recommending medically unnecessary services or upgrades that aren't covered by public insurance. The provincial government says that Bill 60 includes safeguards to prevent patients from paying out of pocket. But the concern is that private for-profit clinics aren't monitored or policed enough to ensure they'll follow the rules. So, what do you think? If you enjoyed this video, push the like button, subscribe, and click all around me to watch more helpful explainers. I'll see you all in the next video. Bye!